For people who've suffered severe burns, there's hope. They can be treated with skin grafts using human skin that's been cultured in a lab. Patients who receive these grafts tend to develop less scarring and usually heal in a fraction of the time. To grow skin, skin cells have to be isolated and collected and made to multiply. It all begins with the removal of a small skin sample. The 10 million cells in this piece are enough to make a culture. The skin soaks in a medium containing penicillin and gentamicin, antibiotics which protect it from bacterial infection. Now a piece of skin is cut and delicately sectioned on a Petri dish with a scalpel. The fat is gently detached from the dermis, since it will not be needed in the culturing. The skin is cut into thin strips, because thermolysin, the enzyme which separates the dermis from the epidermis, acts more efficiently on small surfaces. Then, an enzyme destroys the links uniting the dermis and epidermis cells. This procedure is carried out in this incubator over 3 hours at a temperature of 37 degrees centigrade. Once incubation is over, the Petri dish is removed from the incubator. Only the epidermis cells, called keratinocytes, are retained. The epidermis is detached from the dermis with great precision. Now the strips are placed in a trypsination unit. An enzyme will destroy the links uniting the epidermis cells in order to isolate them. This operation signals the cells to multiply. In order to increase the effectiveness of trypsin, the trypsination unit is placed on an agitator. The liquid containing the cells in suspension is drawn off. Now the liquid must be separated. The desired cells lie at the bottom of the tube, while the upper floating solution containing the trypsin has to be removed. The trypsin solution is drawn off with a vacuum system. In order to eliminate all traces of trypsin, further chemicals are added and the mixture put back into suspension. Now the cells from the small skin sample have to be counted before being centrifuged a second time. The cells are counted by hand using a microscope, or in this specialist equipment. The exact number of cells obtained during a biopsy is determined, as well as the best skin cells needed for maximum growth. The bottom portion of keratinocytes is divided in these flasks, containing a culture medium whose composition resembles blood. Placed in an oven at 37 degrees, the cells will multiply over a week in these flasks. The solution in which the cells are immersed is changed every 2 days. In less than a week, the cells have almost covered the entire surface of the flask. They can now be trypsinated anew to create a further 50 flasks, which in turn will be placed in the oven for about 1 week. Skin strips carpet the inner surface of the flask. They are then detached with a spatula. The flasks are cut in two with a heating unit resembling a soldering iron. To make handling easier, gauze is placed on the skin strips whose thickness is less than 1/10 of a millimeter. The graft is then finally placed on the wound. Clamps and the gauze will be removed after 10 days, and the patient begins the healing process.